Ludwig's angina. It is the infection of the submandibular space. Bacteriology. Infections involve both aerobes and anaerobes. The most common causative microorganisms are hemolytic streptococci, staphylococci and bacteroides. Groups. Rarely Haemophilus influenzae, Escherichia coli and Pseudomonas are noted. Sources of infection. Dental infections account for 80% of the cases. Roots of lower premolars lie above the mylohyoid line and cause sublingual space infection, whereas roots of lower molar teeth extend below the mylohyoid line and cause submaxillary space infection. Others. Submandibular sialadenitis, injuries of oral mucosa, and fractures of the mandible. Clinical features. Presenting complaints are marked difficulty in swallowing, odonophagia and varying degrees of trismus. There occurs swelling in the floor of mouth. The tongue is pushed up and back if the infection happens to be involving the sublingual space. Once the infection spreads to the submaxillary and submental spaces, the submandibular regions become swollen and tender fig. 6. And feel woody hard. There is marked cellulitis of these areas. The frank abscess is uncommon. In advanced cases, airway is threatened. Tongue is progressively pushed upwards and backwards. Laryngeal edema may ensue. Treatment. Systemic antibiotics and incision and drainage are the main lines of management. Drainage material must be submitted for culture and sensitivity. Incision and drainage. Intraoral approach is used when abscess is localized to sublingual space. External approach is needed if swelling involves submaxillary space. Method. A transverse incision extending between angles of mandible is made. The vertical opening of midline musculature of tongue is made with the help of hemostat. Usually, it is serous fluid and not frank pus. It provides significant relief to the patient. Tracheostomy must be considered if the airway is compromised. Complications. Spread of infection. The infection can spread to peripharyngeal and retropharyngeal spaces and then to the mediastinum. Airway obstruction. Airway is compromised not only due to laryngeal edema but also due to swelling and pushing back of the tongue. Septicemia and aspiration pneumonia need immediate attention.